If you haven't done it, you definitely know someone who has taken an Ancestry DNA test. It's the hottest thing. What can our DNA tell us? Well, it turns out there are health DNA tests you can take, and genetic testing is getting bigger and bigger, and medicine is getting more and more personalized, and that is what we're talking about today on Sarah Has Questions. I'm Sarah King, and I have a lot of questions. In this show, I get to ask WakeMed doctors any question I want, and bless their hearts, they have all the answers. Sarah Has Questions is a production of Mix 101.5 and Capital Broadcasting Company, and it's presented by WakeMed. Cheryl Dickerson from WakeMed is here with me today. She is a genetic counselor. Tell me about what you do. What exactly does a genetic counselor do?
Yeah, you'll find genetic counselors in a lot of different parts of healthcare. I would say the majority of genetic counselors work in a clinical setting. So they work in a hospital or a doctor's office. Genetic counselors bring their expertise to talking with folks ahead of the testing to explain, what is this testing? What can it tell you? What won't it tell you? And the results of the test, how can that be helpful?
Sure.
In terms of informing your own health care or that of your children, other family members, and sort of walking people through the pros and cons of it all to help them decide, do they want to do genetic testing?
Well, we're going to get into that. What is the biggest misconception people have about genetic testing?
Well, there are a number of them, but maybe I'll choose that there's one genetic test that can tell you everything.
Okay.
Yeah. So there's not just one genetic test that can tell you everything. Genetic tests target different parts of the genetic information.
The genome.
Right. And so, one test might be good for detecting one type of genetic issue. A different test might be better at detecting a different genetic issue. So it just depends on what the questions are,
right.
what somebody's symptoms are, as to what might be the best way to get at is there a underlying genetic cause?
And so do you guys do those like specified tests because the information you'd receive back if you did the entire genome would be too much?
Well, it in some cases, when you're looking at the entire genome, the laboratory is reporting back information about what they're finding as it relates to the symptoms that somebody's having, right? So they're not just sending you all the information and some of it may apply and some of it doesn't.
You have this problem because of this genetic sequence, and also you're mostly Irish. That's not going to happen.
No. From a medical genetic testing standpoint, it's not giving you information about your ancestry, your ethnic background. There are genetic tests that can do that.
Sure.
But that is not the focus. The focus is trying to get at medical genetic information that can be used as part of the puzzle. To gather more information about what's going on with you.
It's got to be like, I can only imagine doctors are salivating because the genetic, the genome holds all the information. And so the better we get at this, the better we can at being like specifying all kinds of things. So can your genes really predict the future of your children and even of yourself, the health?
Sometimes, but not always. When you're talking about a genetic condition like cystic fibrosis, looking at your genes can give you some prediction about what types of symptoms that you may experience in your life, how severe they might be, for example. But when you're talking about something like diabetes, for example, there's not just one gene that causes diabetes. It's a combination of genes and environmental lifestyle issues that interact with each other to ultimately determine, will any of us develop diabetes? And so, looking at the genes is not at least right now, is not terribly helpful.
Right. I mean,
with
it's not
that.
like an X and a Y chromosome. Like if you have this pairing, that means
right,
this.
Right.
Yeah, it's far more complicated. And
Yeah. So there are a lot of conditions, common conditions like heart disease and diabetes that fall under, we call that multifactorial, where there's some genetic contribution, but there's also environmental lifestyle contribution.
Got it. What is the difference between ancestry genetic testing and health genetic testing?
So with ancestry testing, they are looking at DNA sequences across the chromosomes and comparing those sequences to the sequences that we know are more common in Europeans or African Americans or Asian Americans. So they're making comparisons to gain a sense of, okay, what percent of your DNA appears to be European in origin? What percent of your DNA seems to be Asian in origin? And so when you're making comparisons like that, it's super important that you have a diversity of DNA in your background, in what you're comparing it to make sure you're accurately quantifying what percent of your DNA is European versus another.
And when you're looking at these types of genes, is it like for eye shape and skin color and hair color? Is that the types of things you're looking at?
No. It's like sort of like every DNA has sort of a fingerprint.
Okay.
This fingerprint, there are fingerprints that are more characteristic of the European population. There are fingerprints that are more characteristic of African descent, and so on. And so they're kind of comparing what percent of your fingerprint most aligns with those different ethnic groups to kind of give you a percentage breakdown of what your ethnic.
And how accurate is that?
It depends on the database that they're comparing it to.
Yeah, so the more info you have, I would imagine, the better.
The more information we have from people of all different ethnic backgrounds, the more powerful it is going to be.
Well, I can only imagine it's getting more and more powerful lately.
Yes. I mean, but there are lots of, ethnic groups who are from very small communities and very rural parts of the world that you would have to go search them out and ask, would you be willing to have your DNA be part of this database?
Right.
And if they're not part of the database, then that won't be represented.
That's a good point.
Yeah.
So we've got the ancestry part covered. So that's what that's looking for. Now, what is the health genetic testing looking at?
That is looking more at across individual genes. Okay, so genes are like words. They have to be spelled in a certain way for the gene to function like it should. So when you're doing medical genetic testing, the lab is really looking at all of those genes that we have to see if they find any misspellings in those genes. So it used to be we referred to changes in genes as mutations. The field has gotten away from that terminology.
And negative connotation to it.
Exactly. So we prefer to use the word variant. So we all have variants in our genes. Some variants are what we call benign, meaning they're a variant, but they don't bother the gene at all and it's not going to cause any disease. And then there are other variants that are pathogenic. So we know that they disrupt the gene enough that it will lead to a particular condition. But there are lots of variants that laboratories find that go into this category of variants of unknown significance, meaning we don't have enough information yet to be able to say, are they benign or are they disease-causing? And the goal, obviously, over time is to reclassify those variants, take them out of this we're not sure into one or the other.
Well, and it's funny you mentioned that. First of all, I can only imagine that this is rapidly changing. This is truly cutting-edge science. But before we went on, I mentioned that I have a niece and nephew with a genetic disease. And when they didn't know what it was, There's a database, is there not, that you can put your genes in if you have variants in it, and it runs with like a year, every year or so. Do you have any idea what I'm talking about against like the new things that are discovered?
Well, so clinical genetic testing laboratories generally have a protocol in place where they're keeping track of what they have called a variant of unknown significance when they've identified it. And on a yearly basis, looking at those variants and seeing, do we have more information now to be able to reclassify?
I find that
this
fascinating.
Variant. And so that takes a whole team of people.
Oh yeah, I'm sure,
to do that. But when somebody has a medical genetic test and their result comes back with, okay, we found a variant in this gene. It might be related to your symptoms, but it might not. We don't have enough information yet. The provider who ordered that genetic test certainly can reach out to the laboratory on an occasional basis, say, hey, where are we at with this variant? Has anything changed?
Right.
Do we know more? And on the other side of the coin, if the laboratory does on their own reclassify that variant, let's say they decide that a variant is disease-causing, pathogenic, there's a duty for the lab to try to get in contact with the person who ordered the tests originally to say, hey, we've reclassified this variant. This is information that you should pass along to your patient so they're aware of it, because that then could change their management.
Absolutely. That's fascinating to me. Let's say I get that back. Maybe I have the variant marker for Parkinson's disease. Is there anything I can do for my lifestyle to make sure I don't get Parkinson's disease, or is it like just a guarantee?
No, there definitely are.
That's a random example.
Yeah, right. There definitely are situations where, depending on the variant that you have, that could inform a specific treatment that might not have been considered before. And this sort of ties into the work that's going on with drug development, medication development, that is based on genetic information, that is based on what's the variant in the gene. Can we develop something that addresses that issue due to that variant that will then be more effective treatment for that person who has that variant? So there are some conditions that exists for, but there are many that don't. Not to say that that's going to change as we go forward, because there's a lot of effort being invested in that.
There's so much room to grow.
Yes, exactly.
So I can't change my diet.
Well, you might I'll give you a for example.
Sure.
There is a particular genetic condition called PKU.
Okay.
It stands for phenylketonuria. And folks that have this condition have a treatment available, diet related, where altering their diet will prevent some of the downstream symptoms that can come if this condition was not being treated.
Okay.
From the diet.
But what I'm asked, and then maybe you answered it and I missed it, but if I have that variant, it's not, it is a guarantee that I'm going to get the disease.
Not always. Yeah.
Okay.
Yeah. This is complex.
Yes.
And yes, it's very complex. There are a lot of nuances to it. So sometimes there are gene variants that we can say, you have this variant. We know that you have this variant. We know that it can cause disease, but we also know sometimes people have it and they don't develop disease.
Right. What diseases or conditions are most identified through genetic counseling?
Well, so genetic counseling is a process by which we incorporate somebody's personal medical history, their family medical history, to identify, do we see a pattern? Do we see a pattern of symptoms or a pattern in your family that suggests that there may be this X, Y, or Z condition, and we're doing that in concert with the other members of our team. So physicians are, doing physical exams and doing other tests to gather information, and then we're trying to put that all together to say, could this be something genetic? And if the answer to that is yes, what genetic test could we do that might help shed some light on that?
Okay.
And so, we're genetic counselors, as I mentioned earlier, are trained to help people, not only the patient, but the other members of the healthcare team assess what genetic tests might be the most informative, and then working with the family to help them understand what could this tell you,
right?
What it doesn't, and then on the backside, once you get the result back, helping to the patient and family to understand what does this result mean,
right? Well, but I know that there's like BRCA1, which is the breast cancer one. Are there other, and that one's been pretty well studied, and if you have that, you really need to be careful. Are there other conditions like that that have gotten such a direct link that you can name off?
Yeah, sure. Well, there are in this. When you're talking about cancer, there are certainly certain forms of colon cancer that are very strongly linked with certain genes and the variants in those genes. Pancreatic cancer is another one that has some genes that are linked to it. Really name any cancer. And
so cancer's one for sure.
Yeah. Sometimes
that fascinating.
Yeah. And that's also where cancer is an area of medicine where identifying particular gene variants can then also inform what type of treatment, whether, if chemotherapy is being considered, what form of chemotherapy is going to be best to give to you.
Which is wonderful.
Yes, right. One of the problems in medicine is that you identify a condition, you say, okay, let's try this medication, let's try this treatment, and maybe it's not very effective for person A, but it is very effective for person B, and that goes back to our genetic background.
Yes, exactly. Yes. Yeah, and so, from what I understand, personalized medicine is kind of where medicine is heading, which is fantastic.
Yeah.
Well, you just answered my second question, which was, can DNA influence how medications work for you?
Yes, absolutely.
Yeah.
Absolutely.
I think that's so cool. Why does knowing your family medical history, why is that helpful?
Well, it's one of the easiest ways to get a sense of what conditions, what illnesses have we seen in our family, perhaps that have happened more than once in the family, that could give us some insight, could give myself insight into what conditions might I be more likely to develop. So, for example, going back to the diabetes example, if I'm somebody who has, a number of family members with diabetes, that lets me know that there's probably some genetic predisposition to diabetes. And so I am likely at increased chance of developing diabetes, but it's not, again, all about the genes.
Yeah, the environment also plays
right,
true.
Your lifestyle, your diet, your exercise, weight, stress, all of those things combine with that genetic predisposition to ultimately, determine whether or not I end up developing diabetes. So when you know your family history, and in this case that because of your family history that you're at increased chance of developing diabetes, that gives you a place to say, okay, well, I want to try to work on the things I have control over, which is my lifestyle.
Yeah.
I want to try to make an effort to eat healthy. I want to try to make an effort to get exercise.
Which is everything.
Yes,
every doctor's exercise.
Exactly. So those are the things that you can modify to help potentially reduce your chances of developing diabetes.
But knowing your family history gives you an idea of what to keep an eye out for. So let's say I know that my family has a history of, sounds like if you have a cancer-heavy family. You might have a genetic disposition to cancer. So is there a way for someone just to get like a preemptive genetic test? Can I ask what kind of doctor do I ask that from?
Well, oftentimes folks who have this question about cancer say, I see a lot of it in my family history. It concerns me. What is my chances of developing cancer? So a great person to talk to about that is a genetic counselor who specializes in cancer.
Just like you.
Well, I'm not a cancer genetic.
You're a genetic counselor.
I'm a genetic counselor, but just like you have different areas of specialties like cardiology and nephrology and neurology, genetic counselors get very specialized like that too.
Oh, okay.
So in my current role, I specialize in prenatal, like pregnancy, preconception related genetic testing. We have other genetic counselors at WakeMed who specialize in cancer genetic counseling. So, this is what they think about all day, every day. And they have their finger on the pulse of what's the current best practices for evaluating a family history, selecting a genetic test that is likely to be most informative for you, or maybe saying to you, based on your family history, you don't meet criteria for a genetic test, so it doesn't make sense to do something right now.
Yeah.
So that's part of the family history informs that decision.
Right.
Yeah.
So I would imagine let's just say you wanted to get a genetic test, though, you'd start with your primary care physician.
Talking with them and saying, hey, I have questions about this, and
can you refer me?
Mm-hmm.
Okay, and they're going to know who to do that with. How might the results of my genetic test help me, my children, and other members of my family?
So, genetic medicine is different from a lot of other areas of medicine in that it just is not giving information to you about yourself. It has implications for your relatives. So, in the case, in using the example of the breast cancer and the BRCA gene, if someone finds out that they have a variant in that gene, likely that is something that has been, other people in the family are at risk for having that same variant. And so if I have a sister or, I that would be information to share with her to say, hey,
you may want to get this checked out.
You may want to get this checked out if you want to know more information about this health risk for yourself. And then it's up to the sister to decide if she wants to do that or not.
I wonder if in the future, we pass down family trees, if we will eventually pass down family genetic trees.
Well, that's an interesting question. When I'm talking to folks that I work with to say, hey, we know you have this gene variant now. Please share it with your siblings. Please, when your children are older, please let them know about this, because they may also have this gene variant, and they may want to have this information to guide their family decision, their family planning decisions, and other healthcare decisions.
Absolutely.
Yeah.
And last question: is there any harm that can come from genetic testing aside from anxiety? I would imagine.
Well, and that's not any small thing.
Yeah. No.
Right. That's not a small thing, and in my experience, people approach that from different perspectives. Some people are very much information seeking. They feel empowered with more information. Even if there's may not be anything they can do with it, they still like to have it.
Right.
There are other folks who say, that's not me.
Yeah, because
that just sounds way overwhelming to me.
I get that,
and I just don't think I want to add that into my life.
Yeah,
and that's okay, right?
Yeah.
That's part of what genetic counseling is about, is trying to help people filter those kinds of decisions into whether or not to have testing. We're genetic counselors are very big proponents of not just ordering a genetic test like you would any other medical test.
Yeah.
You need to properly prepare your patient for, explain why it is you're suggesting this test. What are the benefits? What are the could it raise your anxiety?
Is that the only negative thing that could come?
Well, no. I mean, it sometimes can create issues in the family. So in my example before, where about breast cancer and the BRCA gene, so I find out that I have this variant, and I let my sister know, and she does the test and she doesn't have it. Now there's some survival guilt.
Yeah.
That sometimes
maybe
come
some
up.
jealousy
Or
too.
jealousy, right. And sometimes that can create friction.
So it sounds
in a
like the most downside for all this is like emotional mostly, which is not to be downplayed. And I'm sorry that I did so earlier, because I mean, anxiety is an enormous burden.
Right.
Yeah.
And, because genetic information is so personal.
Oh, yeah.
It's not uncommon for people to feel shame about it, even though
they had nothing to do with it.
There was nothing. It was not anything they had control over.
Of course not.
But finding out that I have a genetic variant, sometimes shame comes along with that, and I don't want anybody else to know.
Oh, interesting.
And so, sometimes I'll be asking about a family history, and the person I'm talking to says, well, I know that I have an aunt with X, Y, and Z symptom. And I'll say, do you know if she has a diagnosis? I think she does, but she will not talk about it.
Interesting.
And so that family member doesn't have all the information to be able to share that with her provider to
take care of herself.
Yeah, right. And sometimes my question will be, well,
could you ask him?
Do you think you could ask?
Yeah.
And sometimes the answer is, I do not feel comfortable asking.
Wow.
Yeah. So
your job has many facets.
Yeah, absolutely. Absolutely.
Well, this is really fascinating, and it's a super exciting topic. Yeah. That I love that the fact that medicine is moving in this direction, because it's going to be a whole new world, say in 50 years from now, after we've had some time to really integrate all the different combinations. I mean, this field has legs for sure.
It does.
Yeah.
It does. And developing treatments to help reduce some of the severity of these conditions, I think, is really interesting and going to be exciting.
Yeah. Well, thank you so much for your time.
Yes, thank you.
Thank you so much to Cheryl Dickerson with WakeMed. Personalized medicine gets me so excited. How fantastic would it be if you could go to your doctor, hand them your genetic information, and they can tailor make all the medicine to suit your chemistry? I think it's genius. I can't wait for this to become more mainstream. And if you have more questions about genetic testing, go to wakemed.org. If you have an idea for an episode, we're all ears. Hit us up on our Instagram at Sarah Has Questions. I'll talk to you next time. Be well.